So when we see low back patients here in our office, the three things that we focus on are the spine, whether it's moving well and in alignment, the muscles that surround the spine, whether some are too tight or some may be too weak, and then the third thing is that we're addressing the disc. So just a lot of people aren't always as familiar with the disc as they are with the spine. So the discs are actually the shock absorber of the system. So you have these three curves in your spine that allow the weight bearing and gravity to be kind of dispersed throughout the spine. And these discs in between the vertebra, which are bone, give you some shock absorption and don't allow the bones obviously to rub on one another. If the disc starts to get smaller, the hole that the nerve comes out of also gets smaller. And as that hole gets smaller, you have less room for error if you are to bend over and pick up, your kid or the newspaper. That's why when people bulge their discs, it usually happens because they've bent over and picked something up as opposed to, deadlifting 200 pounds. So the thing that we focus on that a lot of offices don't, whether it's a medical office or a physical therapist office, is the disc itself. And so if you go into, say, a medical doctor's office and you are talking to them about your low back pain and they diagnose it as a sprained strain, meaning that you've sprained or strained the muscle or sprained one of the ligaments, the problem is if the actual root cause of the issue is the disc, muscle relaxers and painkillers can actually be worse for the problem than solving it. So if you mask the pain and you relax the muscles that are trying to keep you from moving around to injure the disc more, then you'll think that you're feeling a little bit better, you'll start to go back to normal activity, and that's when you can start to aggravate it even more. So just to give you a kind of an idea of what the disc looks like from the inside, this is what a healthy disc should look like here. So the nucleus of the disc, it's almost like a jelly donut. So the nucleus of the disc is the jelly. The fibers that hold it in place, which is the disc itself, that is basically the donut that holds the jelly inside. So if it's nice and full, and the reason why discs start to shrink, I'll talk about that real quick. The reason why they'll start to shrink, and if you notice, each disc correlates with a joint, okay? If the disc if the joint stops moving the way it's supposed to, the disc is not able to get all of the nutrition and the water that it needs to stay hydrated and stay full. So that's why your spine moving is such an important thing. So as your spine stops moving the way it's supposed to, this disc starts to dehydrate, it starts to get thinner, this hole starts to get smaller, and that's when you start to put pressure on the nerve. The other thing that happens when it starts to dehydrate is the fibers become more brittle. When they become brittle, they can actually start to tear. So again, this could be from micro traumas, it could be from car accidents, it could be from lifting something the wrong way or twisting the wrong way. So if these things tear, that nucleus will take the path of least resistance because it's a gelatinous material. It'll start to move towards the outside. If enough of these fibers tear and it gets far enough towards the outside, it can actually bulge backwards to where it presses on the nerve. So again, if this is the problem, muscle relaxants, stretches, exercises are not going to fix this problem. So in our office, we always make sure that we're addressing that disc, because what you don't want to happen is for the fibers to completely tear and the disc or the nucleus to move all the way outside of the disc, because at that point it's a lot more difficult to treat. This will end up just sitting on top of that nerve, and until the body starts to eat up that foreign material, it'll just stay there for a long time. That's usually when people have to start talking about surgery. So we want to keep things healthy and moving correctly, and so if we can get people adjusted and keep their spines healthy, this is how the discs can stay. But if you're at the point where you have a disc problem, you have to make sure that the healthcare provider that you're going to is going to be addressing that disc and is going to have some solutions for what we can do about it, and we'll talk about the solutions in another video. So if you know somebody who's dealing with a disc problem, or you yourself are, make sure you like, comment, or share below, and we'll see you on the next video.